There is also a great news in the field of kidney cancer that came about, that there is a urine test that can actually find the risk of kidney cancer, 95% accuracy. There are two proteins that are in urine, ocuoporin and perlipin. We never had this before. We always use either a CAT scan or MRI to detect someone that has kidney cancer. Now, with a simple urine test, we're able to really detect this. This is something very new. About 700 patients were in that group. So that's also a very exciting one. And certainly we see that in the field of prostate cancer, we're getting more and more of these tumor markers coming in, whether it's PCA3 that we see. So if you have a high risk of prostate cancer, family history, if your PSA is high, before you jump into these biopsies, there are things that I do in the office. One of them is called PCA3, which is a urine test. After the exam, we're able to check your urine to make sure that those cells are not there, et cetera, and that can help us. There are also a lot of other tumor markers. We have now prostate health index, and I want you to know about this because prostate health index measures not only PSA, but free PSA and also P2 PSA. So these are different families of PSAs that can help us detect prostate cancer. And finally, there's something called out there 4K score, which is also looking at four different tests, and it gives you a grade or percentage, less than 1% or risk of over 95%, etc. So all of these tumor markers are coming in and is actually helping us. And finally, smoking and prostate cancer. What we're finding out is that on patients that have had prostate cancer who have had treatment, and I always feel the best treatment for prostate cancer is removal, and basically because you get the very accurate staging, your PSA after surgery should be zero and it's under control. And you can use radiation after surgery if it's necessary. But in this particular study, they found out that the group that continued to smoke after surgery, they will have a higher rate of recurrence. So if you want to do yourself a favor, stop smoking. And that's really the news that we had this whole week.